Just want to start broad with this report. Can you tell me what it is and why you went about it the way you did? So, really generic, just to start, so people get an idea of what this was all about.
Sure, maybe I'll provide a little background and then Matilda can jump into the details of the report a little bit
Sure.
more.
Yeah.
So, we've had over the last couple of years at the federal level and in New York State new regulations that pertain to service lines. Those are the lines that connect your home or business to a water system, right? Those regulations are really aimed at finding out what materials our service lines are made of, if they're made of lead, galvanized service lines that would also require replacement, or something else. And then over 10-year period between 2027 and 2037, replacing those that need to be replaced that are made of lead or galvanized. Those regulations, the federal lead and copper rule, and at the state level, the Lead Pipe Right to Know Act have gone into place and have also required by October of last year, 2024, that we have our initial inventories of all of those materials done. That's with the goal of then by next 2027, having a baseline inventory that is full and complete so that we can then make a replacement program. This report really analyzed all the data in those initial inventories that were due and all the data that they had up through July of this year.
Okay. And
Yeah, so I think as Laura was saying, this is just kind of the first preliminary report. We were using data that was provided between October to July of this year, and it's just kind of a status check-in of where we're at now.
when you, I guess, what did you look at in terms of, did you go municipality by municipality? How many did you look at when it comes to some of the numbers of how far reaching this went?
Absolutely. So we did look at each individual system that was required to submit an inventory. So out of those, 2,938 water systems were required to submit an inventory. About 92% of those did submit an inventory by July. So that's about 2,695. About 8% are still missing and have not submitted an initial inventory yet. And then within our report too, we kind of separate out large systems that serve more than 50,000 customers. And we also look at it through a county lens. So looking at each system within a county and kind of calculating some statistics based on county level.
Okay. And then when it came to these inventories that were submitted, what were some of the trends that you found?
Yeah, within across all the systems, we did find some inconsistencies. So, for example, within some systems, there were some discrepancies. So, a system could have reported 500 known service lines, but only be reporting 200 non-lead, 100 lead, and 100 galvanized, meaning there's some sort of error in their reporting. So, we did find some inconsistencies. We also found some incompleteness with those about 240 systems that have not yet submitted an initial inventory. And then within the systems that did submit, there's a wide range of unevenness. So some systems are reporting a large amount of unknown, and some are reporting a really small amount of unknown. And then within those, some are reporting a very large amount of lead service lines or galvanized lines that need to be replaced. So for example, we have Buffalo where they're reporting 84% of their known service lines are in that category of lead or galvanized that will need to be replaced. In Syracuse, it's up to 77%. So then other districts like Jericho Water District on Long Island and Erie County Water Authority and Amherst are reporting less than 1% of their known. So there's a wide range.
Yeah, that's really interesting. When it comes to this data collection, I think you pointed it out, throughout the report, the challenges that these municipalities face when it comes to this. What were some of the challenges that you learned about through this process of putting this together?
Sure. So apart from our data analysis, we had previously hosted a couple of forums with various stakeholders, officials, staff on this issue. We also spoke to a number of them through the process of doing this report. And what they had to say was that there are a number of issues historically with records keeping at the system level, many of which go back several decades across a lot of water systems in New York State. We have some very old districts, as you know. Another one is that there's just a lack of familiarity with this new reporting process, the templates, and as you can imagine, particularly for smaller districts, limited bandwidth, personnel-wise, staff-wise. And then the broader availability of technical resources and other resources to bring to bear on this that would help fill in those kind of personnel gaps or training gaps that are needed. And so I think a lot of them pointed towards the need for further technical assistance in order to fully and completely finish these inventories, as well as just, I think, further training and communication on how to use the tools that do exist. There are state and federal programs aimed at providing this type of assistance, but the broader availability of those seems to be pointed to.
The new reporting templates and processes which you just spoke to and sort of getting used to that, when was that put in? Was that part of the Lead Pipe Right to Know Act? What was what was the timeline of that?
Some of that was put in place through the lead and copper rule improvements in between 2023 and 2024. And so the EPA provided state departments of health with templates to use. They then also tailored those further to that specific water systems in our state. And those systems further sometimes tailored those communications to their customers and residents.
One of the lines in there that I thought stuck out to me was undermine some of these issues, these challenges could undermine or delay the state's ability to fully implement the existing regulations for public health. I guess you speak to that a little bit in the research, but how? How does this undermine, delay this process?
Yeah, I think without having a full and complete inventory by that 2027 deadline, we won't be able to make a really good, solid plan for replacement over the following 10 years. Now, some systems have already started replacement, and so people may be seeing that happen in their own communities. But the deadlines, regulatorily speaking, are for 2037. So that gives us a sense that there is time to do this, and there's time before 2027 when that kind of 10-year timeline starts to get this right and to make sure that we have the information we need to efficiently and equitably distribute the resources that are going to be needed to replace all of these service lines.
First I'll ask, where does legislation come with this? I guess how that's currently on the books or some that could help that you heard about or learned about?
Yep. So we've mentioned the lead and copper rule improvements, the Lead Pipe Right to Know Act here in New York. There are further proposals in New York for the Lead Pipe Replacement Act that would codify some of the existing federal regulatory timelines. And that would make it easier for water systems to go and do replacements on properties where maybe there isn't as much communication or cooperation.
What about funding wise? How does that impact this in terms of where the funding is now? Because I think I saw in there to be able to facilitate this, 3.7 billion would be needed to do it by 2037 as that date.
Yeah, I know that number sounds very big, but we're basing it, and this is in earlier reports that we put out, on the EPA's estimated number of lead pipe service lines that we have here in New York. And so based on those earlier numbers, that's how much it would cost to replace all of them. Now, some of that may be covered through local bonding and rate changes. Some of it may be covered through further federal funding. So far, we've received about 115 million each year over 5 years from the federal government for this. But it may also take state funding. And in order to know what state funding will be necessary and where it should and could go, these inventories are really an important part of that challenge.
Is there any, impact of uncertainty when it comes to EPA funding, things like that, that moving forward in the future, depending on the administration at play? Because I know the bipartisan infrastructure law, had a role here from the last administration. Is there any, thoughts on that when it comes to speaking to some of these stakeholders?
Yeah, that funding was key. It is what provided that $115 million over 5 years that we were talking about. So further federal funding like that will be key. If and when that is going to happen, I couldn't say.
The other element I did want to ask also about you mentioned staffing challenges, and there was a bit of an anecdote in there about the Department of Health and the state, how the people that you spoke with said there's only one person assigned to overseeing this aspect. Can you speak to that a little bit more?
That's what was reported to us through a number of sources. I can't really speak any further to that.
I mean, I guess I think you spoke also to the municipalities needing people to do this, right? I guess how much does staffing weigh in this process of having, because you mentioned historical records, I'm sure that's something you need to go through. I mean, where does the staffing component on a bigger scale come in? I just wanted to
Yeah.
make sure I brought up that anecdote just to kind of speak to the staffing needs that are I guess necessary in this, right?
Absolutely. And I think we can take it at two levels, right? You're asking about state staffing, and then there's also local or system staffing, right? And
Exactly.
there's
Yeah.
a clear need for further system staffing in a number of places. And that may not just be more people, it may just be more capacity building, technical resources, other things. At the state level, what we found, given what stakeholders had said to us and what the data reflected, was that there's a need for further attention to data and data validation here, and further perhaps technical capacity to make sure that we are meeting all of these requirements in the time that we have. Thankfully, we still have some time to do all of that.
And that kind of goes back to what Matilda probably was talking about when some of the discrepancies, right? I mean, does that play a factor in some of the, like you mentioned, some of that data that was like a cross section as well as to how each municipality is handling it at all?
Yes, I think from our conversations too, there have been some, minor technical issues with submission. So I think with any new system, we expect, that there's a learning curve for both local water system staff and Department of Health staff, that they had to set up these new systems. So we expect that these systems will, get better as more familiarity is gained by all people working on this issue.
And you brought up a couple of examples across the state. Were there trends depending on like the makeup of a city, the location at all of where it was, or was it just kind of, basically depending on where that was? I mean, more random than that. I don't know if like the struggles are
Yeah.
regional, I guess I should say, or I mean, not struggles, but the data that you saw was more regional.
I will say kind of overall, I think a lot of other research too in this arena suggests that older housing stock is more likely to be at risk of having, lead service lines or galvanized service lines. So in newer communities that were built, in very recent decades, they do have a lower risk. For us to make other kind of analysis on discrepancies, we really need full data from each community. And then hopefully, we can shed more light on exactly the unevenness and potential inequalities across this risk.
And one of I remember the conversations I've had with officials about, trying to get these assessments done was the private public, of someone's private residence or an apartment of not the knowledge there. How much is that a factor here in all of this in terms of the pieces of the pie of getting these assessments?
Matilda, I don't know if you want to speak a little bit to how things were counted. I know that that's different across different systems, but what I will say is that in terms of federal regulations, it's required that the whole of the pipe be replaced. That's the public and the private side in order for it to count as being replaced. And that public health research wise, what we know is that when we have partial replacements, right, of just one and not another part, we tend to have further exposures instead of reducing exposures, which is the goal of these replacements as a whole. And so that's why importantly, both at the federal and the state level, a lot of the work has been towards supporting full replacements of both the public and the private side. The ownership of those sides can be different, however, and that can present a challenge here in New York. But there has been further legislation, there have been further opinions from the Attorney General's office and others about the ability of systems to access those in certain kinds of cases. And what the proposed legislation that we spoke of earlier, the Lead Pipe Replacement Act, would do is make clear that systems will have the ability, without liability, to go in and replace, provided certain criteria are met, the private side as well.
And you've done research on this beyond this analysis. I guess, can you speak more broadly to the importance of this? At the end of the day, why this is an initiative that matters, in these municipalities too?
Sure. I mean, I think a lot of people at this point know lead and lead exposure can be really detrimental, particularly to young children at sensitive developmental stages. And that's why at the federal level, our health-based goal for lead in drinking water is zero, none. And so really, even though currently you may not have an exposure just because you have a lead service line, this is aimed at making sure that in the future, we don't have any further exposures that would put young children or anyone and any vulnerable population in particular at risk of such an exposure.
What do you think? I'm just kind of opining now, but what do you think triggered some of these policies? The goal to 2037 to be able to get these assessed and have those windows. What was it? And we're here in the year 2025, and obviously we've known about lead for a long time, as you say. But I guess what have you found that helped kind of get this moving in a direction where people understand that this is something that needs to be addressed?
Yeah, I mean, I think sometimes these things move a little slower than we might expect, but looking back, I think a lot of people saw what happened in Flint as something that really touched them, that was really important to be addressed, that we didn't want to see happen elsewhere. And while the same set of complex circumstances that led to those exposures may not be happening, it's important that we can address some of the underlying risks and potentials that were in place there so that that can't possibly happen anywhere else.
Interesting. I lived in Flint during that time. So obviously that's where some of the interest comes of this topic specifically. But like you said, there was different choices made that problem worse. And I'd imagine a lot of this is to help avoid that, right? And make sure that something like that doesn't happen. Because obviously there was the water was bad and it leached the pipe. There was a whole issue there, but at the end of the day, they were lead pipes, and it kind of was an example of here's what could happen if something, if the wrong decision's made, right? And I feel like that, because I was curious how you'd answer that because of that. Because obviously that, I remember when I was there, it was about 10 years ago now. I remember being there, and they're like, yeah, it's a problem, but it's going to take us a decade to get all this out of the ground, and it was kind of mind blowing because you saw a lot of people suffering, for a lot because of how bad the water was, right? It's kind of scary.
Yeah, an incredible amount of suffering. And I think in that case that there were a lot of decisions that were made for various reasons that led to that happening that didn't have to be the case. And that wasn't only because there were underlying lead service lines, but that was a component that resulted in those exposures because of the decisions that were made. And I think taking that out of the equation as part of the risk factors involved, I think can help make sure that we just don't see anything like that ever happen again.
Yeah. Finally here, if both of you want to answer this, just anything else, obviously we'll have a link to the report so we can go look at it, but anything else people should take away from this analysis moving forward?
Yeah, I think that, this analysis, you might read it and wonder, what could you do yourself, or if you are potentially concerned about the service line that's in your house. So we do have linked on our report how to test for your own service line and some more information that if you or your family is concerned, that might be helpful.
That's great. And Laura?
I think just to know that there are a lot of regulations that are in place already that are trying to address this. It's a matter of trying to get right the underlying knowledge that we have about where these are and aren't, importantly, across our state so that we can really efficiently and equitably make a plan to replace them all.
Okay. Thank you so much for your time. Really appreciate it.
Thank you.
Thank you.
Appreciate it.